Well, I mean, we live in a state where tobacco abuse is rampant, where our diet could use a lot of work, where people live in poverty, where people use prescription medications for non-prescription reasons in high numbers. And so this leads to poor cardiovascular health. And we know what we need to do. We need to improve our lifestyles. And we're in a state where the weather is good and we can do this and we can get out, where food is plentiful and available and good food is available, and we can move on from tobacco simply by making the decision. So a lot of this is in our hands. Well, I think it's reasonable to say, if you look at a very, very small town, the first thing to do is see what's the area that they draw their patients from. Rochester, Minnesota is a very small town, draws from the entire world for patients, and so their procedure volume is certainly high if you look at the Olmsted County where the Mayo Clinic is. But it is also reasonable to say, you're in a small area in a small state that's not densely populated. Where are your patients coming from, and why is your procedure volume so much higher than, say, the procedure volume in a larger community per patient seen? I think that's a reasonable question to ask, and I think that it's being asked. And I think more and more we're being asked to justify the appropriateness of our procedures, and I think that's good for our patients.